Hi viewers, welcome back. Now, as a part of the minor disorders of pregnancy, today we are going to discuss the disorders which is related to the nervous system. So, when we come to the nervous system, we have three major areas where we have to be concerned with. So, first thing is your carpal tunnel syndrome. Okay, so what is this carpal tunnel syndrome? It is nothing but the mother usually feels pain in the thumb, index and the middle finger. So these three fingers are affected because of the median nerve compression. Okay, so you don't have a great physiology for this. So it is just because of the fluid excess during pregnancy. There may be a mild compression of the median nerve, and because of that the mother may complain of severe pain in these three fingers. So she cannot lift anything, she cannot carry on with the daily routines. Okay, so it is like little troubling area where she is unable to do her daily routines. Okay, so the management for carpal tunnel syndrome is like you have to go in for like mild massage in that area. Okay, so you cannot go in for like hard massage also. It is like a mild massage you have to do, and it is like most of the time it recovers by itself. Okay, so within few days, like once this compression is relieved, there will be a relief in this carpal tunnel syndrome. So most of the time, sometimes what happens till delivery it will be there, like after delivery it will be resolved. Okay, so anything can happen. And then comes splints. So you can use splints. You will have a splint that is available for your thumb and the index finger where this movement will be restricted. So that type of splints you can use for the mother. That is also helpful to relieve the pain during the carpal tunnel syndrome. And then we have corticosteroid injection. So steroids, again, it is not recommended during pregnancy, so you need not take corticosteroid injections during pregnancy. So you can tolerate this pain, like slowly it will be relieved. Okay, and like according to the symptoms, like symptomatically you can manage. Okay, so maybe like you can apply a mild hot application, massage, that will be sufficient. So that is with your carpal tunnel syndrome. And then we have the headache. Okay, so again, headache during pregnancy is very common, as because like the perfusion is like more centered towards the placental region and to the other vital organs. There may be inadequate perfusion. Because of that, there may be headache for the mother. And sometimes it is because of the tension during the pregnancy. She may have lot of anxieties, worries and fears, so that can also increase the headache of the mother. So usual management for headache is like she has to go in for rest. Tell the mother to go in for rest period, so she can have a 10 or 15 minutes break, like she can lie down for few minutes. So most of the time the headache gets resolved with this. Sometimes you can just tell the mother to have a face wash. She can go into the open space, like she can have a fresh breath, like so that she can feel little more comfortable and her oxygen saturation level also improves. So with that, like the headache will be relieved. So again, this is like one common complaint where like most of the time we don't recommend any medications, like where it will get resolved by itself. Just make the mother psychologically understand like her workloads are very severe, and because of that there is headache, like that will get resolved by itself. Okay, then comes insomnia. Again, it is a major complaint during pregnancy period. So I usually tell like insomnia is present during antenatal period, because like postnatally you have to slave without sleep. Okay, so you have to stay back with your child all throughout the night during the postnatal period. So God has created something like insomnia in the antenatal period where you can't sleep. Okay, so you don't have any major reasons during antenatal period for insomnia, but you get insomnias. Okay, you are not able to sleep because of, sometimes it is because of your fear and anxiety towards the delivery. So sometimes your insomnia is due to the fear and anxiety during the pregnancy, like where you have to, like they will be having negative thoughts, like dreams. All those things will be disturbing their sleep, and they may not have a continuity in their sleep. Sometimes what happens, it is because of the movement of the fetus, like it keeps on moving all throughout the night, and because of the the mother may not sleep. And sometimes because of the frequency of micturition, so usually in the first trimester and last trimester, there is direct compression of the uterus over the bladder. So what happened? The mother will have frequency of micturition. So when she is having frequency of micturition, she will definitely have a disturbed sleep. So these are the reasons where they are complaints of insomnia. So management part, when we deal, first is like you have to decrease the fear and anxiety of the mother. So whatever may be the fear of the mother, so sometimes she may feel like about maybe the previous pregnancy, previous delivery, or like about the health of the fetus or anything. So you have to give psychological support to the mother to relieve the anxiety and fear of the mother. And then we have to provide rest. So in case if she is not sleeping throughout the night, she is going to have hangover from the next day morning. So you can provide her rest during the daytime. So maybe it is not like too long, again it will cause disturbance in the next day's sleep. So never give a long period of rest, like encourage maybe 1 hour to 2 hours of rest in the like afternoons or in the evening, so that like she will have little comfortability. And then warm waters or milk, so encourage the mother, she can have a warm water or a warm drink before sleep. And sometimes it is like a warm bath before sleep. So these all can promote sleep for the mother. And then supportive pillows, like you can provide the mother a comfortable position to sleep. So during pregnancy, we always tell the mother to have left lateral position, so she may not be comfortable with that position. So provide supportive pillows at the supportive pillows near or under the abdomen, that is like under the baby, so that like there is like little more comfortability for the mother. So these things can be done to improve the insomnia. Okay, so these all can relieve the insomnia of the mother. She may feel little comfortable and she may sleep throughout the night. Okay, so these are the three major areas when we come to the area of the nervous system, where we have carpal tunnel syndromes, headaches and insomnia. Hope you understood the topic. In case if you have any doubts, you have to comment in the comment box. Take care. Bye.